Mass vaccination has been marked out as a key intervention in the global fight against coronavirus. But due to religious, medical, and philosophical reasons, that has been met with a great level of hesitancy. Vaccine hesitancy has become a global challenge, increasing worldwide concern about the general non-acceptance of COVID-19 vaccines. Hence, in developing strategies necessary to ensure compliance to achieve herd immunity, it has become imperative to undertake robust and comprehensive measures that are likely to enhance the uptake of COVID-19 vaccines. One of such measures is the vaccine mandate Nigeria rolled out on October 13 for federal civil servants. The federal government announced that with effect from 1st of December 2021, all federal government employees will be required to show proof of COVID-19 vaccination or present a negative PCR test done within 72 hours to gain access to their offices in all locations within Nigeria and its mission. A mandate that has been met with diverse reactions.
From 1st December 2021, all federal government employees shall be required, all without exception, shall be required to show proof of COVID-19 vaccination or present a negative COVID-19 PCR test result done within 72 hours to gain access to their places of work in all locations within Nigeria and in our missions.
Should vaccination actually be mandatory, or should citizens have a choice whether or not to take the vaccine?
I don't really think it should be compulsory because people should be left to choose whatever they want to do with their life. It's a health issue. I may want to take, the other person may not want to take. But for emphasis sake, people should try as much as they can to take the vaccine.
If as a government or as an institution or agencies, if they want their personnel to be vaccinated, they should not compel anyone. It's either they make provisions or modalities making their staff to get vaccinated, not making it compulsory that it is a must. It should not be a must, but if you want your staff to be, you help them, and that's all.
If the government want to make it compulsory, then we can't really tell, we don't have option. But if it's not compulsory, those that want to be vaccinated should be vaccinated, while those that doesn't, they should allow them.
The rate of people that have taken the vaccine is very low in Nigeria compared to Western world in abroad. And those who have received the vaccine in abroad, it has really worked on them much better. But in Africa, generally in Nigeria especially, they believe it's not necessary for them to take the vaccine.
For me, it's not right for government to force people to go out of their wish to take the injection. Because in some certain countries now, there are some negative reports we are having over the issue of that COVID drugs. Like in some, like Namibia or some about 2 or 3 countries now, they have banned the use of Sputnik, that is Russian type of vaccine. So you can see there are controversy over that issue. So for me, people should be allowed to do their will and take the COVID-19. Whoever wants to take it will take it, not forcing them.
But does Nigeria have the resource and capacity to vaccinate at least 70% of its over 200 million population? Statistics by the National Primary Healthcare Development Agency say that as at Monday, October 4, 2021, Nigeria has taken delivery of over 10 million doses of vaccines and had vaccinated over 4 million eligible persons across the country with the first dose of AstraZeneca and Moderna vaccines, a number that has barely scratched the surface in comparison with other African countries. With the increasing number of COVID-19 cases globally, mandatory vaccination has become a global practice. A top college coach in the US alongside 4 of his assistants were fired for refusing to take the jab. Uganda has also mandated its government workers to take the jab or not show up at work, while Zimbabwe has threatened to fire unvaccinated government employees. But whether vaccination should be mandated or made a choice, to end this pandemic, we must achieve enough level of population immunity, and the only way to achieve that is if eligible persons get vaccinated and observe non-pharmaceutical interventions against COVID-19.